And good morning. Thanks so much for joining us. I'm Cheryl Miller. October is Dental Hygiene Month and a great time to talk about practicing good oral care and what good oral care is. Good oral hygiene goes far beyond just brushing twice a day. Local dental hygienist Olivia Mark is here with us today. Hi, Olivia.
Hi, good
And a big
morning.
bright smile there. It looks fabulous.
Thank
And that's
you.
what everybody wants is a wonderful looking smile.
Absolutely. Absolutely. Yes, Dental Hygiene Awareness Month is a great time for us to bring more awareness to the public about how to take care of their teeth and how to help create a beautiful smile, but also importantly to help share what our role is as a dental hygienist in not only your oral health, but also your overall health as well.
Well, let's talk about that.
Yeah.
What is a dental hygienist's role?
Yes, thank you. Well, when a patient comes in for their hygiene appointment, the most important thing we do is a gum evaluation. And in that, we detect if there is any type of gum infection from gingivitis, which is a milder form of gum infection that affects the gums, to periodontal disease, which is more serious, affecting the gums and the bone holding your teeth in.
And we're looking at a healthy smile
Yes.
here. And so this is what you want to see when you look in the mirror is healthy pink gums.
Absolutely. Not only that is when you're brushing and flossing, you don't want to see any bleeding. Anytime there's bleeding, it's a sign of infection. And also, if you can see some puffy gums as well. As you can see at the top picture, there's some calculus and tartar buildup on those bottom front teeth, which is infecting the gums. You can see the gums look a little more red and swollen, which is creating an infection in that area.
So what level is that picture? So is that just gingivitis or?
It's hard to tell. It's definitely gingivitis. It's hard to tell without getting in and doing our full evaluation whether it's more involved into periodontal disease, which means it's affecting the bone that's holding people's teeth in. And periodontal disease is actually the #1 reason why adults lose their teeth, but more importantly, it's been linked to increased risks of heart attack and stroke and respiratory problems. And patients who are diabetic have a harder time controlling their blood sugar if they have periodontal disease, and pregnant women are at a higher risk of premature birth and low birth weight if they have gum infection.
So these are the kinds of things you look for. You can have the healthiest teeth in the world, but if your gums are not healthy, then...
Absolutely, absolutely. And some patients will say, well, I didn't come in because I didn't have any problems or I was not in any pain. And 75% of Americans are actually infected by gum disease, and a lot of those patients don't realize it. They're not aware of the symptoms. So that's why it's so important to come in regularly for your dental hygiene visits so we can play a role in detecting that. And ask your hygienist when you're there. Ask them to show you pictures of your gums. We have intraoral cameras we can use that can show you areas of infection. We can tell you how the results are of your gum infection, so you can play an active role in keeping your gums healthy. I find patients have so much more success not only controlling their gum infection and the health of their gums, but also keeping their body healthy when they have the active role and they can actually see what's going on and know what's going on in their mouth.
And you mentioned some of the other things that can come as far as health problems as a result of having unhealthy gums.
Correct.
What is the connection between them?
The bacteria that builds up in your mouth, it forms underneath the gums, and it forms along with plaque and tartar. And if that's not removed, that bacteria is causing inflammation in your mouth. And your body is always trying to fight off inflammation. So whenever there is that infection or inflammation in your mouth, your body works overtime. And a lot of times with gingivitis and periodontal disease, it is a chronic infection. So your body is constantly working overtime trying to fight that bacteria and that infection, and as I said, it's an increased risk of very serious health problems, and not just in your mouth.
So quickly, Olivia, what should we be doing to prevent gingivitis and periodontal disease?
Sure, the biggest things are taking care of your mouth at home by brushing at least twice a day for a full 2 minutes, and flossing, making that a part of your daily routine. And there are other tools you can use as well, and your hygienist can help you, guide you which tools would benefit you the most in keeping your gums healthy and your body healthy, but also going in for your regular routine checks. And sometimes for some patients that's every 6 months. Some patients need to see us more often, every 3 or 4 months, to control the infection.
Something to think about.
Yes.
Olivia Mark, thank you so much for joining us today.
Thank you for having me.
Thank you for all that you do.
Thank you.
You're very welcome. And we want to get over to still to come on Virginia this morning. Frederick's